without further ado, Dr. Cutler last year blew them away to the point that our evaluations were all about Dr. Cutler. So we kind of figured out that maybe we wanted Dr. Cutler back as our keynote. And then I went and visited his facility and confirmed that. So I'm very, very happy. And he does a lot of work also with Sarasota County. So I want to welcome him. And his staff is fabulous. He's fabulous. And he even wanted to sponsor this event. So you have to know his commitment to this event, because I think that's important. Thank you.
So, first of all, I want to say good morning, class. I just feel like I need to say that. Doesn't it feel like we're back in school here in this place? Okay, so next week's assignment is chapters 3 through... Kidding. So how many of you are here from Manatee County? I'm just curious, who work in Manatee County? Mostly. Okay, how about Sarasota County? Oh, quite a few. Are some of you work in both counties? Did people raise their...
large, and they're...
Yeah, some people raise their hand twice, I guess. How about any other counties besides those? Okay, that helps me understand it. Now, how many people have heard me speak before, either last year here or somewhere else? Great, because I've made up all new stuff for you this year, so it should be really interesting. I do want to thank, too, I would be remiss without thanking Deb and the village that made this possible. And I hope we're going to have a little bit of fun today. So I wanted to just quickly follow up on my company, Florida Clinical Research Center. We do research children and adults of all ages, ADHD, autism. We had some Tourette's studies that have ended, but they come periodically. So a variety of interesting things. All right, my goal today is to introduce you to the world of ADHD. And I think this title says a lot. ADHD, it's all in your head. Now, what do I mean by that? That's sort of a rhetorical question, but I'll tell you what I mean by that. A professor of mine used to say, when people ask me, is it all in my head? He'd say, yes, your brain is in your head. So, you know what, that joke used to kill when I did it in the Holiday Inn Lounge, but not. Maybe it's an evening joke, I don't know. Did you show them where the coffee is, Deb? Because caffeine. All right.
2 over.
Yeah. Okay, we are actually, it's interesting, my office is right down the street. We're on Cooper Creek right off of University, and we're very serious. Have you come for a visit and see what we do and how we do it. Okay, enough about that. Let's move on. So this is, my boys go to a Montessori school called Newgate. Some of you may have heard of Newgate Montessori. And so these pictures here, you can see this girl's wearing a Newgate shirt. And I'm actually chairman of the board of Newgate School. So I have lots of free time, obviously. But this is meant to represent kind of what it's like to live with ADHD. I mean, certainly I know you guys live with it from the outside perspective, observing it and trying to help these kids. But for a minute, let's imagine what it's like to live with ADHD. To feel like your one hand is tied behind your back. And you're doing the best you can with your one hand, but you can't keep up. And people are expecting you to do your work as if you had 2 hands. So just imagine for a moment what that must feel like. The frustration, the feeling of, I don't think anything's wrong and I'm doing the best I can, but I keep getting this negative feedback and I keep failing. So I always try to keep that in mind because sometimes it is very challenging, isn't it, working with these kids? And so hopefully what we're going to try to do is get you to be able to find strategies to help these kids maybe to function better, cooperate, get along with their peers, do their work, that kind of thing. Was that working for you, or was that just a horrible, silly way to start? It's pretty good. All right. All right, good. Good. I'm going to keep this in the, I'll keep this in the deck because this is new. I didn't have this last year. All right, so what is ADHD? Well, it's the most common, what we call developmental neurobehavioral disorder worldwide. The incidence is actually about 10%. Now, if you look at textbooks and on the internet, it'll say something less, usually 4 to 8%. But I can tell you in my experience, those estimates are very conservative. I've presented information and presented posters at research meetings around the world, literally. And wherever I do, I always kind of see the same data shows up. It clusters around 10% all around the world. So this is quite common. Now, ADHD, of course, stands for attention. Oh, sorry, one other thing I wanted to say about that. So when I say developmental neurobehavioral, what that means is This is a neurologic condition in a way. I'm going to show you actually some pictures of the biology and of the wiring and what's working and what's not working. And it's a developmental disorder, meaning it starts early and affects development of the child over time. The behavioral part is really part of the challenge, because if you think about it, I don't have a physical symptom like shortness of breath or headache. We don't have an X-ray or a blood test or something concrete I can show you to prove the diagnosis. We really have to observe behavior, especially in kids who can't describe what they're going through as well as adults. Okay, now it stands for technically attention deficit hyperactivity disorder. All four of those words are wrong, in my opinion. Nobody seems shocked by that. I kind of thought that would be like a zip. Maybe you're just stunned. All right, so I'm going to explain why I think that's wrong. It is highly genetic. I'm going to show you a little bit of data on that, on how genetic it is. But what that means for you is that if a child has it, at least one of the two parents probably has it. The odds are overwhelmingly high. So you may have a situation where you're trying to talk to a parent about how to help this kid and manage it, and the parent's looking at you and smiling and nothing's going in. They're distracted and thinking about something else. Or at home, they're having trouble, keeping things organized and consistent and doing the things you'd like them to do. So just understand that a little bit too. It's highly genetic. And the most important concept I'd like to get across to you, and maybe in your work with others, is it's not good or bad. I really think those terms are damaging. I try to resist that. And even sometimes when I'm talking about normal versus abnormal, I may slip today a little and say, well, this is abnormal brain or something. But I don't mean it that way as in good or bad. It's different. Okay, so the next point is the wiring is actually different. The wiring of the brain. And so it's no more good and bad than right-handed or left-handed is. It's just different, right? There are actually some things the ADHD brain does better than the non-ADHD brain, but school's not one of them, unfortunately, at least traditional school. So they process information differently. A consequence of different wiring is you process information differently, and I'll help you understand that in a minute. The most important concept that helps me understand that it's not good or bad is that in some settings it's adaptive, it's an advantage. Okay, so for instance, people with ADHD can function very well when there's a lot going on around them. They can multitask really well because their brain likes to be engaged and it can handle things, many different things at once. It's not good, ADHD brain is not good at sitting still, paying attention to one thing at a time and listening to one person talk. So you can see how it really depends on the situation and the environment whether it causes problems or not. Now, there's a couple myths I always like to start with about ADHD. Again, I remind you of this title of which all four words are wrong. The first one is, it's not attention deficit disorder. Parents will come to me all the time and say, well, he can't have ADD, he can pay attention to video games for hours. Well, sure, it's because if you're interested, you lock in, you hyper-focus almost too much. And if you're not interested, you can't pay attention. So it's an all or none problem. It's a problem of regulation of attention, not a deficit of attention. Does that make sense? It's a very important concept because it really helps understand the biology. There's a part of the brain that's not working, and the job is to regulate things, to moderate them. So if it's not working, you get stuck. You don't have the ability to easily shift or adjust. Okay? Hyperactivity is not necessary for the diagnosis. In the old days, we would call it ADD. Now, just to quickly explain that, you may say, well, why are you calling ADHD? What's ADD? ADD is an older term that we don't use in the medical profession anymore. It's now all called ADHD, and there are subtypes, and one of the subtypes is predominantly inattentive, without much hyperactivity. That's what you would have called in the past ADD. Okay, so I'm fine with you saying ADD. I know what it means. I sometimes use the term too, even though technically it's not a medical term anymore. Okay, so just so you know, we use them interchangeably. It's not a disorder, as I said. To call it a disorder is not fair because in some settings it's an advantage. Okay, so that's sort of not the right word for it either. Now, the other myth is, of course, that these kids, especially kids but also adults, are lazy, dumb, or, quote, doing it on purpose. You hear that all the time. So the laziness, what that comes from is the fact that they really resist engaging in things that aren't terribly interesting, and they procrastinate, and they'll try to get out of doing their work, and they'll forget and this kind of thing. It's not lazy at all, because you'll see if they're interested in something, boy, they just get right into it, and they could spend all day and have lots of energy. So it's not a good way to think of it. It's, again, a problem with regulating things. ADHD has nothing to do with intelligence. I still to this day hear that all the time from parents, and I understand, I get it. There's ignorance out there. People just don't know and understand. They think something's wrong with your brain, so it must affect your intelligence, but that has nothing to do with it. I certainly work with and treat very successful people. Doctors, lawyers, businessmen. You told me the story of a kid with ADHD who's just done phenomenally well, as a matter of fact.
Self-contained ESC,
yeah.
And mainstreamed him in 5th grade, and I've stayed in contact with him, and he has his doctorate.
Got a doctorate.
And he just got a $100,000 grant in Dublin, and he's working with Disney, and it's 3D computer and fabulous.
Isn't that amazing?
Self-contained ESC.
Yeah.
Want to get a mainstream.
Exactly. So the point is, with the right interventions, and I'm not only talking, I'm obviously going to focus on medication, that's what I know, but it's a combination of everything. You don't throw pills at people and fix problems, right? So the right intervention, including that, especially in an educational environment, they can go on and do great things. All right. Oh, doing it on purpose. This is because one of the problems is that it's so variable the way it presents. Sometimes the kid seems to do what they're supposed to do and behave well, and other times they don't. And if you understand this as a failure or a disorder of regulation, of moderation, that'll make more sense to you. And you'll understand the kid's not doing anything on purpose. It's just that their brain sometimes engages and sometimes it doesn't. So that can be frustrating for parents, I know. And then, you know, they should act their age. I mean, my gosh, it's so obvious. Can't they learn that if they keep doing this, they get in trouble? If they don't do their homework, I take their computer away, whatever it is. They should know better. Well, the problem is that part of their brain that should do those things isn't working. And as a matter of fact, what studies show is that emotionally, kids with ADHD are delayed by an average of 2 years. So they're about 2 years more immature than their age, their chronologic age. They can be as intelligent or more, so it's not a delay at all of intelligence. As I said, they can be very bright, and that actually can get them in trouble sometimes. Because one of the problems with ADHD is boredom is your enemy. So if you're very bright, you're going to get bored in class a lot, you know? So that's when they get in trouble. So it's very important to understand that you're looking at a kid who looks 10 or 12 and has the intelligence of 12, but emotionally is 8. Or something like that, all right? So that might help too. Because really what it's all about is our expectations, and helping especially parents with expectations. What I sometimes like to say is, if you expect an elephant to fly, and the elephant doesn't fly, whose fault is that? The elephant's? No. It's my expectation is wrong, right? So it really helps to understand. I always say knowledge is power, because then you understand and you can adjust your expectation and help these kids in a better way. I showed you the kid with one arm behind their back. I sometimes will tell families it's sort of like you're trying to run a race with a broken leg. You might finish the race, you're not going to win it. So why do you expect yourself to win it in a way? Why do you expect yourself to be able to function as well as, in the same way as others, I should say? All right. I think I may be blocking you guys. The other one is, which I already talked about, you can't have ADHD if you're successful or a professional. As we said, that's just not true. Oh, I love this one. I had them tested, and they said they don't have ADHD. And then I spend 5 minutes with the kid, and I go, oh, yes, they do. So what's happening there? Well, a couple things. One is that if a kid is intelligent, a professor of mine used to say IQ points can compensate for a lot. So they can do very well intellectually in school, but again, behaviorally and emotionally, not so much. So that can be one thing. The other thing is, sometimes if you have these tests, there's obviously norms in the test. So a kid who's extremely bright has high potential, scores in the normal range, and you go, well, they're normal, you know, it's fine, they scored normal. But that's underachieving for that kid. So you have to understand what's that kid's potential, and are they reaching their potential? The other one is a lot of our ADHD, quote, tests, and there's really no test for ADHD, okay, just so you know. But some of these screens and tests, and you may have seen some of them. Has anybody seen like the Connors checklist? There's a teacher version. There's a Vanderbilt. There's a bunch of these. But if you look at them, they tend to be sort of yes-no questions. Or at least, you know, if the symptom's there, how severe is it? And I'll give you a great example of how this can go wrong. If I ask a parent, well, does he lose things? And the parent says, no. Well, then the kid doesn't have the symptom. But if I know enough to probe and follow up and say, well, how come? She goes, oh my God, we have the system every night. We label the bins and right? So no, he doesn't lose it, but boy, I spend all day doing it. So he does have the symptom, and you have to work hard to compensate. So there's an impact on that. It takes up time, if you will, okay? So that's one thing. The other thing that I've recently learned, this is brand new. There was data presented recently. I was at the American Psychiatric Association meeting 2 weeks ago, and there's a controversy in our field about the importance or the value of neuropsychological testing. And I know that in your world, that's done a lot. It needs to be done. You need to see a psychologist and get evaluated, and that's fine. But one of the issues here is there's something called cold testing, and there's something called hot testing. Cold testing is you have the kid in a quiet room without any distractions, and they do the testing, and they may do fine. But that's not the world they live in. Hot testing is you have them in a room with noise and distraction, and they actually have a lab set up where you can do this. There's a model for distracting kids while they take these tests, and then they do very poorly. So it really depends on the environment and the demands that are on the kid at the time. So there's a lot of reasons why this happens. Oh, one of my favorites. So I've alluded to this. I keep saying the ADHD brain is different. It's wired different. It processes information different. There's some things it does better. Well, let's look at what that is, okay? And then after this, we're going to get into the underlying biology of what explains this to you. But first, we'll start with what you can observe. Well, the non-ADHD brain is organized around the principle of priorities. So this is important. I'm going to pay attention. I'm going to do this. That's fun over there, but let me do this first, and then I can go have fun, right? Guess what the ADHD brain is interested in? It's organized around novelty and interest. It says, okay, this is important. Ooh, there's something fun over there. I'm going to go do that. I'll do this later. There's always time to do that later. And because, as you'll see in a minute, they have a bad sense of time, they really believe that. There's always time. That's how you can procrastinate, because whatever you're doing at that moment holds your attention. I've had people describe this to me, and again, this is one of those ways that I really empathize and try to sympathize with what they struggle with. I had a guy I just saw on Monday who said to me, I feel like I spend all day spinning my wheels. My brain's like searching for something interesting. And when I find it, I lock in and it's like heaven. And I just go, I can calm down and focus. And so imagine spending all day, your brain's constantly searching, looking for something interesting to lock into. And then somebody pulls you out of that because you can't do that. So they tell you, stop doing that. And you have to, now you're back to this thing. So it can be a frantic search for interest. The non-ADHD brain processes information in a linear fashion. So it goes A, B, C, D. Well, the ADHD brain is non-linear. It goes from A to D very quickly. Now in school, what can happen with these kids is on a test or a problem set, they can get the correct answer, but they can't show their work. And so they get in trouble, and I've had kids accused of cheating. And it's really because the brain just doesn't work that way. It's very hard for them to slow their brain down, back it up, and kind of go through this process. Their brain's already skipping ahead to D. I don't B, C, D, D, D. Or it goes A, F, P, Q. And that's why it's processing information more horizontally rather than vertically. And so that's why they're good at multitasking and can sometimes handle a lot of things at once. Now, non-ADHD has a consistent sense of time. You can sort of budget your time. You can estimate how long something might take, right? If you're an adult, your wife can call you and say what time you're going to be home, and you can tell her, and it'll happen. But if you have ADHD, incredibly variable sense of time. I mean, obviously, without ADHD, there's some variability to it, but it's incredibly variable. So if you have ADHD and you're doing something interesting, 2 hours will seem like 5 minutes. But if it's not interesting, 5 minutes seems like 2 hours. So it's really tough, and kids will have a really hard time then with the concept of time. They'll often be late. They always feel like they have more time than they do. Again, the adult will say, honey, I'll be home in half an hour, and they're just making it up. They have no idea. Because between now and a half hour is a lifetime. I'm going to find 17 interesting things to do, and I get caught up in what I'm doing. I don't notice time passing. That's a very important concept, too, of how the brain works. And that may be important in some situations, all right? Non-ADHD can delay gratification, and there's actually a biochemical reason why they can do that. It has to do with dopamine. People with ADHD, on the other hand, need immediate gratification, and you certainly know what I mean there. And they're very impatient when they want something. So non-ADHD not only have a good sense of time, they can plan They can prioritize things. This is more important, so I'll do this first. They can be proactive, you know, and get things done ahead of time. Well, obviously ADHD, they're very impulsive and reactive. They're just living, again, in the moment, and the part of the brain that has to do with planning ahead and prioritizing is not working. So again, we're expecting an elephant to fly if we expect them to be able to do that. We have to help and compensate for that. And along with that, if you don't have ADHD, you can learn from the past, you can anticipate the future, you can take information that you've learned and apply it to new situations, but not if you have ADHD. You're living intensely in the moment. Non-ADHD people can entertain themselves. They can sit there and, you know, look out the window and think about things. If you're riding in a car, they can look out the window. So they can sort of find things to entertain themselves. Not ADHD. Boredom is your mortal enemy. And you've got to have external kind of things to take your mind off of that. They just can't sort of sit with themselves in their own thoughts. It's just too painful, I think. It's just not how the brain's wired. Okay, you ready to rock? All right, let's get into some interesting stuff. I actually have a t-shirt that has that on it. The company gave me this t-shirt. Isn't that great? You can find that on the internet. There's nothing proprietary about that. Okay. Now, just to remind you guys who live with this, ADHD obviously can affect many aspects of people's lives. So what you see here is a kid, can you guys see okay? All right. And you'll see all the different things this can affect. Obviously, family relationships. Studies will show family satisfaction and parental satisfaction is way lower with an ADHD kid in the house. Comorbidity, I'm going to show in a minute. By comorbidity, what I mean is it's very rare to see a kid who only has ADHD and nothing else. So comorbid means something else at the same time with ADHD. And sometimes that something else is what people focus on, or that's what gets them in to get help, when really the problem, that's the tip of an iceberg, and ADHD is really it. Sometimes it's not. If you get the ADHD, you have to look and expect these other things, and they may be less obvious, but they're just as important. Quality of life for the kid and the family, I mentioned. Academic difficulties, again, underachievement, not reaching their potential. Or I look for very variable performance. If they have an interesting subject or a very good, interesting teacher, they'll do better, but if not, worse. So you look for this kind of fluctuating performance. Peer and social interactions, these kids, again, because they're about 2 years less mature, they have a lot of trouble with that. They can sometimes be seen as bossy, impulsive, you know. And then daily living, of course, they have trouble with chores and homework and forgetting to put things back in the refrigerator, to leave food out overnight. Gosh, I sound like I live with an ADHD kid. How would I know that? All right. Now, do you guys know what the DSM is? Have you heard of that? Yeah. So, excuse me, I'm getting a little dry here. DSM is the American Psychiatric Association's textbook, a manual, if you will, for making our diagnoses. It gives the criteria you need to meet to qualify for a diagnosis. There have been several versions over the years, and May of last year, 2013, oh my gosh, a year ago, it is May, a year ago, exactly, the DSM-5 version came out. A lot of us were hoping they would make some really good changes and really address some of the problems with the old diagnosis, but unfortunately they didn't. They made a few tweaks to the ADHD section, but in my opinion, and others, not enough, but I'll show you some of the things they did. First of all, to meet criteria to make a diagnosis, so when you refer someone or when I get a referral, it's obviously not me just kind of looking at the kid and going, oh yeah, I think he has ADHD. We have to actually go through an evaluation. And you have to have at least 6 out of a list of 9 symptoms of either or both of 2 categories. So the first category is symptoms of inattention, or IA. So there's 9 potential symptoms of inattention. And you have to get at least 6 out of 9 of that category and or the next category, which is hyperactivity/impulsivity. Now, why did they call it hyperactivity/impulsivity? I don't know. That's how it was done years ago. And as I'm going to show you in a minute when I go over the biology, there should actually be a third category of symptoms. If you look at the biology, there are actually 3 different circuits involved, not 2. So there's literally circuits and networks in the brain that are involved with regulating your attention and regulating your motor activity and your impulsivity. And those circuits are obviously affected, but there is a third circuit that I'm going to mention in a minute. So anyway, back to the DSM, at least 6 out of 9 of either or both. And there are different subtypes depending on whether you have just 6 out of 9 of one or the other, or 6 of 9 of both categories, those are considered different subtypes of ADHD. Now, this is one of the big changes of DSM-5. In DSM-4, you had to establish that symptoms had started before the age of 7. Before the age of 7. Now, that's very hard to establish. When you're talking about an adolescent or an adult, that's hard to prove or for them to remember. I don't remember what I was like in nursery school or kindergarten, So luckily for us, they made it a little easier by raising the age to 12. Now, another factor can be, especially if a kid isn't terribly hyperactive, this may not become obvious or a problem until they get into, say, middle school, when now you have to start managing your schedule and going to different classes. When you're in one class and the environment's more structured and contained, it may not be as obvious. So I'm glad they did that. Oh, thanks. Thanks.
Got a lot of water.
All right. Yeah, I love hydration. Very important. I'm going to mention that in a minute. Okay, there needs to be a sense of pervasiveness. By that I mean it can't just be in one setting. It can't just be school or just home. It needs to be present in at least 2 settings. So that would include school, home, socially. Okay. Impairment, it needs to be clinically significant. It needs to have some kind of impact either on function or quality of life. So that's usually there, of course. If you just have symptoms and they don't cause any problem, okay, but usually when you have symptoms, they're causing a problem. And then it can't be caused by some other condition. There are many other conditions like schizophrenia or bipolar disorder that you don't want it to be, you don't want to miss that. Because symptoms of inattention and hyperactivity can be seen with a variety of conditions. How about if I move over here, just for the sake of moving? Change it up a little bit. Speaking of attention, do you know how long the average adult can pay attention for one clip at a time, if you will, one segment at a time? 5 minutes. So I'm going to try every 5 minutes to move or to say something stupid. How's that? Just, check. It's like an Etch-a-Sketch. Some of you are too young probably to know those. Everybody knows. Etch-a-Sketch, you draw the thing and then you've got to shake it and sort of refresh and start over again. So I'm going to do a little Etch-a-Sketch on you here. All right. Without going into too much detail, I wish I had more time. But I'm going to show you these symptoms rather quickly. They are available elsewhere, so for the sake of time, and my slides will be available to you, but these come right out of the DSM. If you just Google symptoms of ADHD, you'll find these easily. So here's the 9 symptoms. Failure to pay close attention to details, making careless mistakes. So rushing, not reading the instructions, that kind of thing. Difficulty sustaining versus initiating attention. So for attention, there's 2 things with attention. One is you have to initiate. There's a noise, you have to pay attention. And then there's sustaining attention. These kids obviously can initiate because they're distractible. They're going to look at everything, but they won't sustain. That's the trouble for them. Okay? It's actually 2 different circuits in the brain that do that. They don't seem to listen when spoken to directly. Okay, that's obvious. They don't follow through or finish things. Adults have told me that I'm a great starter. They can always start lots of things and they have things half finished. And these are kids who will, they'll be right in the middle of something and they'll just either think of something else or they'll get up to go get a drink of water, but then once they're there, there's something else, and before you know it, this is in the rearview mirror. Okay? Also, difficulty organizing. Now, it says tasks or activities. Notice that's kind of funny to me. It should also be things. They have trouble keeping the room, neat and organized, that kind of thing. But what this is referring to also is kind of getting organized for an assignment. Again, kind of preparing ahead of time, getting things together that you need, reading instructions and preparing to do something. All of those. It's all of those things. This is, again, boredom is your mortal enemy, but avoids, dislikes, or reluctant to engage in tasks that require sustained mental effort, schoolwork, homework, chores, things like that. Not interesting. Losing or misplacing things, and it can be a variety of things. Easily distracted by extraneous stimuli. Now, let's see. I want to go back a sec because there's something here, okay, about difficulty sustaining attention. This is kind of getting internally distracted, and the one I just showed you is externally distracted. So sights, sounds, noises, distracted by things going on around them. And then especially having trouble getting back to a task once they've been distracted. Forgetful or absent-minded. Okay, so those are the 9 potential. You don't have to have all of them, just 6 out of the 9. One of the other changes I didn't mention in DSM-5 is for adults, they've lowered the criteria to 5 out of 9 of either of these categories. The thinking there goes along with the old notion. We used to be taught that ADHD, you outgrow it. But that makes no sense. This is a genetic, neurologic wiring thing that you're born with. You don't outgrow things like that. It changes. Your brain does develop, and so some things do function a little better. You can learn compensation strategies, and you can choose your environment. When you're a kid, you can't pick your environment. They stick you in school. When you're an adult, you can find situations that play more to your strengths. So what they're recognizing there is that you may not meet all the same symptoms. These original symptoms, by the way, were written for hyperactive boys. I'm not kidding. That was the original research was done on hyperactive boys. And we now know that it's probably 50-50 that girls and women can have it as often. It can present differently. There is a higher incidence of the inattentive type, or the old ADD without hyperactivity, in females, but not exclusively. I've seen some very hyperactive girls, believe me. And I've seen some very inattentive but not hyper boys, so it can go either way. Typically, though, the inattentive type is not diagnosed as early because they're often a kid who's sitting in the back of the room spacing out and not causing problems. You know, the ones who are really hyper and impulsive, they come to your attention earlier. Okay, hyperactivity, impulsivity. So it's like the motor's running. They're fidgeting, tapping, squirming, just hard to sit still. So this is when you're in your seat. There's also one about getting out of your seat here. So there are two different things. So having trouble staying seated or struggles to stay seated. Runs or climbs excessively in inappropriate situations. In adolescents and adults, it's something that kind of goes internal, and now it's a feeling of restlessness. Obviously, as an adult, you're not running around on the playground and swinging from the jungle gym, or at least you might for brief periods, but then you get tired because you're old, you know. Kind of funny. I mean, a guffaw, a chuckle, something? All right. All right. Difficulty playing or engaging in leisure activities quietly. Now, this is two things. They make noise, but it's also they have trouble sitting and engaging in quiet activity. So it's not just they make noise, but just to sit and read a book, for instance, you know, by themselves. That's really hard for them. They need, again, that constant entertainment and activity. On the go, driven by a motor, talking too much. Blurting out answers before questions have been completed. Now, there's two items that have to do with blurting or interrupting. This is the first one, and this is where you're engaged in a conversation with someone or a one-on-one with the teacher, and you blurt or cut that person off. There's also going to be in a minute interrupting, which is two other people are talking and you interrupt them. You see what I'm saying? So yeah, I'm interrupting you if you and I are talking, but we consider that this one, blurting out. And then this is just impatient, difficulty waiting in a variety of situations, and here's the interrupting or intruding on others, barging into other kids' games or activities. All right, so we used to call these different types, subtypes of ADHD. They changed the terminology now to presentations. So whatever, it's the same thing, we just changed the words. It's all right. So first we have predominantly inattentive presentation. That's what I called the old ADD. That's 6 out of 9 of the inattentive symptoms, but not the hyperactive impulsive. Oh, this is backwards. I don't know why my animation is messed up, but it should have been. Combined type is first. Combined is the most common. That's where you have at least 6 out of 9 of both of those. That's the most common type. About 2/3 of kids have that. The next most common is the inattentive type. So combined, wow, my animation's really screwed up. That's just to keep you on your toes. How am I doing? You paying attention? Everybody alert? All right. So 6 out of 9 from both, 6 out of 9 of inattentive, and then there's predominantly hyperactive impulsive, which is really very unusual. I mean, studies show it's only 3 to 5%, because if you think about it, if you're hyperactive and impulsive, you're probably not paying attention. You know, it's unusual to just have that. But theoretically, in a research setting, you can meet that. And then there's a category we used to call NOS, not otherwise specified. It's now called other specified or unspecified. All right, whatever. That's if we think you have it, but you don't quite meet. Sorry, I didn't mean to sound dismissive. We think you have it, but you don't quite meet all the, let's say someone says, it started when I was 13. I promise you, it was 13, nothing before that. Well, then you didn't quite meet before 12, but you have everything else. And my thinking on that is probably it was there, the person just didn't know it, or, if I could have access to a teacher or a parent, they would be able to give me better information. So, all right. Now, I talked about comorbidities. Oh, gee whiz. Wow, I'm really going over. Okay, I really got a lot to do here. Okay, comorbidities, these are common things that can be seen with ADHD. And as I mentioned, the majority of people with ADHD, probably at least 2/3, if not more, have something else on this slide with ADHD. So for instance, I hate this term, disruptive behavior disorders. So the first one is ODD, which stands for oppositional defiant disorder. I hate that term because it sounds so negative. You're labeling the kid as oppositional or defiant. But as I told you before, they're not doing this on purpose. They can be very stubborn and they can get stuck. And this is the third cluster of symptoms I was talking about earlier. Remember I said there's inattention, there's hyperactivity, but there's a third group. Now that we have more technology and can look at the brain circuitry, we know that actually those symptoms, which are stubbornness, temper tantrums, kind of making a mountain out of a molehill, arguing, talking back, those things, and doing things that look like they're on purpose, breaking the rules, those things are all associated with another circuit that's regulated by this thing that's not working. So I think of that really, and about 2/3 of kids with ADHD have some of these symptoms. That's too high for this to be a totally separate disorder. You know, that doesn't make sense. They're too tightly linked. Conduct disorder, these are the kids who are really bad kids. These are kids with black hearts. They're the ones who are going to go on to be antisocials, sociopaths, criminals, that kind of thing. And so that's a little different. Mood disorders, the two most common things you see with ADHD, besides the ODD, which I think is actually part of ADHD, the two most common things are depression and anxiety. And some of that may be secondary because you can imagine if you're always forgetting things and screwing up, you start getting anxious and worrying about what's going to happen, or you start getting demoralized and depressed. That's secondary, but also some of the same circuits and some of the same chemicals that are involved in producing ADHD are also underlying your mood and your anxiety control. So I'll show you something about that. Learning disorders very common, especially milder dyslexias. The kid who reverses the B's and D's, for instance, or has trouble, you know, numbers upside down, all kinds of things like that. But they can have a lot of trouble with reading. They really, part of it is they hate to read, but part of it is the circuitry that it takes to read and comprehend is just not working well. Also, they often have trouble with writing, with getting thoughts out of their head. They can be very verbal. They can be great at telling you, but that's a different circuit from writing it. Tic disorders is common, and then something called SPD, you might have heard of, sensory processing disorder, which is probably related to the dysregulation. Occupational therapy is you get evaluated by an OT, you get treatment with OT. The OT world says medicine doesn't help. That's not my opinion. In my experience, medicine helps tremendously because it's probably fixing the same wiring, and it allows them to do better with the OT. So it's not either or to me. It's always a combination of interventions. This is what it looks like. For the sake of time, I'm going to move on. This is just what, you know, this looks like. You can see that only about 1/3 of kids in this study had ADHD alone, and the rest had something else. All right, here's what I told you that it's genetic. On this slide, we have a list of certain conditions and how genetic they are. And so ADHD is a 0.8. It's almost as genetically determined as your height, which you think of, I'm sure, as a very genetic, right, thing. It's more genetic than asthma and breast cancer, which we think of as genetic diseases. So again, this is why I said when you see a kid, at least one of the two parents, and sometimes both, has it. The other thing you'll see is siblings will have it, but they don't always have the same type. They can look very different, and especially the really hyperactive one gets all the attention, but the other one may be having just as much trouble. They just don't get as much attention because they're not as disruptive. Also, the flip side, if an adult has ADHD, and remember I told you the incidence of ADHD is 10% in the general population. But if you have ADHD and you have a child, every child you have has a 50% chance, right? Which tells you this is very genetic because it's much higher than it would be to just the normal population. So, you know, every time you see parents, a parent with ADHD and they have 3 or 4 kids, the odds are a couple of them, you know, might have it. That's important. You laugh, but it's helpful to me in working with families. You know, it can be very helpful, believe me. Okay, so genetic. All right, real quickly, I'm going to get into the biology. I'm not trying to turn you into neuroscientists, although you're welcome to study that if you want. I'm very happy to talk to you about it. We know now from really years of research